I am Raffaella Casolino, a medical oncologist and researcher currently serving as a cancer expert on the cancer team at the World Health Organization in Geneva. I'm here today with Professor Andrés Cervantes, the president of the European Society for Medical Oncology, because during the recent WHO Executive Board meeting, the WHO has reconfirmed from ESMO the special status of non-state actor in official relationship with WHO, along with a new collaboration plan for the years 2024-2026. The WHO and ESMO are both committed to reducing the inequalities and improving access to cancer care, including prevention and treatment, with the overall goal and a great ambition to reduce the global mortality of cancer and contributing to the goal of universal health coverage. Professor Cervantes, from your point of view as the president of the Society for Medical Oncology, that represent all of us, European medical oncologists, but also global medical oncologists and other professionals. What do you think is the relevance of our community of such an important collaboration?
First of all, I want to say that it is a privilege to be granted again the status of non-state actor in official relationships with the WHO. ESMO, representing more than 35,000 oncology professionals worldwide, is well placed to offer guidance to policy decision-making and action because it is equipped with the scientific evidence that is needed to inform decisions, as well as the practical evidence that comes from the feedback of all those professionals working on the ground. So I would say that ESMO members have to be proud of this achievement.
Certainly, we are very proud. The technical collaboration between WHO and ESMO is implemented through multi-annual work plans. The next 3-year collaboration plan outlines the areas where we shall see tangible achievement and activities. The first area of collaboration is about supporting WHO to identify priority interventions for cancer care and increase access to essential cancer medicines. This can be done through different ways, for example, through the support of the Ministries of Health in the optimization of national cancer treatment protocols, or thanks to support of the review of the cancer medications submitted for inclusion in the WHO model list of essential medicines.
With the overall goal of ensuring that optimal care becomes accessible to everyone, everywhere, one of the pillars of the ESMO Vision 2025 is accessible cancer care. And ESMO has always been particularly active in elaborating ways to rethink the allocation of finite resources to secure the best possible care for all cancer patients, while reducing the number of people who develop the disease in the future. For this activity, ESMO is providing the tool to collect preliminary scoring of cancer medicines applications, the ESMO magnitude of the clinical benefit scale.
This is a very important tool developed by ESMO specifically to facilitate improved decision-making regarding the value of anti-cancer therapies. And actually, it has been used to support the assessment of cancer medicines for the optimization of national cancer treatment protocols when requested by ministries of health in the past. And this was an important area of collaboration between ESMO and WHO. Another important area of collaboration is related to cancer prevention.
With the number of new cases of cancer estimated to increase by almost 50% by 2040, anticipated in low and middle income countries, we cannot but do everything that we can to reduce the burden and stop the disease before it hits. That's why, even if it may sound illogical to some, ESMO has become active also in the field of prevention, serving primarily as a dissemination network of education for oncologists who have a crucial role to play by becoming knowledgeable and leading by example. But prevention is not only a topic to be aware of for healthcare providers and the wider population. It's primarily a global, societal, political matter.
Last but not least, ESMO will also play a role in the optimizing the health workforce for cancer care in order to strengthen health delivery systems, which is another important area of action of this 3 years collaboration plan.
ESMO, as the referent for oncology education and information, is always at the forefront when it comes to educating the oncology community and advocating for a sustainable healthcare system for the benefit of patients with cancer and the doctors caring for them. In the coming years, ESMO will also support the WHO to finalize and implement a comprehensive tool and planning approach for cancer care workforce.
The activities in this area will include data collection and analysis to identify the country-specific needs for the oncology workforce based on the specific disease burden and availability of resources to support the WHO discussion with the ministries of health and the local stakeholders.
Very important. I think it is self-explanatory that the collaboration between ESMO and the WHO in all these crucial areas will be beneficial for the wider oncology community, being composed of doctors, patients, institutions, regulators, all those who need to make important decisions that can only be made properly if based on scientific evidence, which we are proud to provide.